Share a mic.
Yes. So you're not surrounded by Lancet people.
It's great to be surrounded by Lancet people.
I feel the expectations are quite high. Proportional to my lack of confidence that I can deliver what they are.
There's quite a lot of senior looking people actually.
Yeah. How these young people will want to light.
There's water.
They surely will people whose papers were rejected.
I can see Peter Arbe. Hello. Hello. Good afternoon. It is 5:45 and you're still here. I'm very proud of you. I hope you still have some energy left for this session that we have this afternoon called Meet the Editors. we don't have any slides. This is an advance warning. We were hoping to make it a bit interactive, so we're hoping on your participation to this session. Ask all your questions so you can walk away having learned whatever you wanted to learn from this session. So my name is Michelle Helinski. I work as a senior project officer at the EDCTP2 office in the Netherlands, in The Hague. And I'm co-chairing this session with Moses, and Moses will introduce himself briefly.
Right, so I am Professor Moses Bokari. I deliberately put the professor bit in because it's very important for all what we're saying here today, because I started my career as a young scientist from Africa and then went to become professor of tropical health sciences in the Liverpool School of Tropical Medicine, and went through all what you want to know today about getting a grant, publishing your papers. So it's very important that I would completely agree how important this thing is. So, but until April, I was head of the EDCTP Africa office in Cape Town, so I know how important this is for all of you.
Well, thank you. And we have lined up a stellar panel of editors for you to this afternoon. We have 3 people in the room and 1 person joining us online. And I'm not sure if it's possible to pull David up somewhere on the screen so he can join us from the start. That looked promising, but Well, so while David is getting set up, shall we go a quick round of introduction to our 4 wonderful editors. I'm going to take them in the order that they're seated here, because that's the easiest. So, Zhao, do you want to start? Introduce yourself.
Sure. Thanks, Michelle. Thanks for the invitation. It has been really a great pleasure to join you here in Paris. My name is João Monteiro. I'm the chief editor at Nature Medicine. I have been with the journal for 6 years and have been working as an editor for about 11 years as a professional editor. Nature Medicine publishes translational and clinical research at all phases, public and global health as well. A little bit of implementation research more recently. And I'm looking forward to your questions.
Thank you. Marco.
Hello, welcome all, and good for you that you've stayed so far. My name is Marco De Ambrogi. I'm the deputy editor of the Lancet Infectious Diseases. I've been with the journal for 9 years, and our journal, quite similar to what Joao just said, publishes clinical research. Of course, we have a lot of different content, not just articles. But yes, the focus is on clinical research that may be relevant for communities, also some implementation, genetics, modeling. I mean, we like everything that has something to do with infectious diseases, and we're very passionate about it.
Thank you. Zoe?
Hi, my name is Zoe Mullen. I'm the editor-in-chief of the Lancet Global Health, which was the Lancet Group's first open access journal, which I launched 10 years ago. Before that, I'd done all manner of other things at the Lancet, so can consider myself a sort of Lancet lifer, if you like. But there's always more to learn, and I look forward to learning from you all. Thank you.
Thank you. And last but not least, joining us from Ghana, David, do you want to introduce yourself, please?
Yes, I'm David Oforeke from Ghana, and I'm the editor-in-chief of the Ghana Medical Journal. And I've been editor-in-chief for about 24 years. The journal publishes general medical articles. It's not a specialist journal, and we come out quarterly. So this is me. I look forward to your questions.
Thank you so much, David, for joining us. So we now know who's here. We don't quite know who is here on the other side. I did see all your answers to the question of what you want to learn from this session. I had 240 rows in an Excel of people's hopes for this session, what they wanted to learn, which gave me already a good idea of who's here today. But just maybe for us also to get you moving a little bit, I wanted to find out from this group here, how many people have ever published in a peer-reviewed journal? And how many of those have published more than, say, 10 articles? And how many have published, say, less than 5? Still a few people. And how many people have published maybe in the Lancet or in Nature Medicine? A few less. So I think we now know a little bit about you, and I also have a few of your questions already on paper here, but feel free to come when we ask you to come with questions. Go to the microphones, or we will bring the microphone to you so you can also, we can hear your voice. But I think what we wanted to do for this session is to go through a number of the topics that we put in our outline, and our editors are going to share their thoughts, and one of them is going to focus on a particular topic while others are going to add. So the first topic we actually came up with is now actually what is the role of the editor in the entire process. And Marco is so keen or so kind to share with us his thoughts about what does an editor do. So Marco, over to you.
Okay, thank you. So I will talk about my experience. I've been in publishing for 12 years, and but my experience at the Lancet is what is more relevant because it's what I do, and I've been doing for 9 years, as I mentioned. I see the role as an editor as a sort of very active role. Maybe some might think that we just sit there and wait for things to be submitted through the computer, and then we just click reject immediately. So that is not the case. We wait 5 minutes and then we click reject. But of course, part of our job is to check the new submissions, assess them, decide with our very stringent criteria what is eligible for peer review, depending on the section, but there is a lot more than that. There is an active component, which is the main, and it is an engagement with the community that we serve. I feel, and I'm sure my colleagues feel the same, we feel part of the community. Our journals sort of addresses in some sense. And what is important for me as an editor is to be in tune with what the community wants to hear, what is eager to learn, what are the hot areas in the field, and that kind of engagement, it comes through meeting like this, through constant emails and contacts, through commissioning pieces, through even studying in real time on what is being published, what are the hot areas, what are the controversies. In my journal, I'm known to be someone who thrives on controversy, so if there is anything that is controversial in the field, it tickles my interest immediately, maybe because I'm Italian and I quite like a fight. Yes, I need to have the adrenaline running. So in terms of what is the daily job, of course, there is the assessment of new submissions, but I would say that that's a minor component of my day. My main work is about peer review and then assessing the manuscript throughout the process, assessing reviewers' comments, making decisions, doing teamwork and team meeting to decide the fate of the manuscript. In the Lancet, we have a very permeable system, and twice a week we discuss all peer-reviewed manuscripts with the entire group of editors from other journals, so we share comments from them, we reach a consensus together, and that is very helpful because for me, I see what other papers have been submitted to other Lancet journals. In the 9 years I've been with the Lancet, I learned a lot on what is deemed right or wrong, where we set boundaries, where we can be flexible, and I always like to push boundaries by nature, so it's good to know where you can do that and where you cannot do that. But overall, I also commission pieces. I mean, I manage several sections in my journal. I work in inclusion and diversity. I'm really engaged into representation of research from all over the world, representing different ethnicity, gender balance. So there are all projects about how to improve the journal in that sense, but as it is for all journals, we're only as good as the people we work with, and the journal would not exist with strong research and strong personalities that provide pieces to us. So, well, basically that's in a nutshell what's coming.
Thank you very much, Marco. Now, I mean, EDCTP is all about collaboration and ensuring equity and ensuring that no one gets left behind. So Joy will now talk to us about how, as an editor, I mean, she ensures that, or the journal ensures that there is equity in the publication process.
Thanks, Moses. Yeah, so we do take that quite seriously at the Lancet journals, and Lancet Global Health, I think, has pushed some boundaries maybe in that area. I mean, in terms of primary research, when we're looking at, and obviously Lancet Global Health gets a lot of research from that's been done in low and middle income countries, and if we receive a paper and we don't see any authors from any of those countries, then that's a straight reject for us. You know, we're now at a point where helicopter research is we hope dead, and so we won't have any of it in Lancet Global Health. We've done something else recently, which is to try and push that a little bit further, so that rather than just seeing that we've got some names from the right region on the byline, we actually want to find out what those people did. Were they truly partners in the process, or were their names just sort of stuck on there for sort of a bit of, going through the motions. So we're now asking authors to submit with their revised paper. So if your paper comes through and it's been peer reviewed at the revision stage, we're asking authors to submit an equitable partnership declaration. So it's a questionnaire, and it asks questions around that we ask you to fill in a free text way, how the locally based authors were involved in the various stages of the research process. So the design, the analysis, the interpretation, etc. We want to know about community participation. How was the community involved in designing the research question, and how they're going to benefit from the findings? We want to know how any funding was used to do any capacity building in the area. We want to know about safeguarding of research staff, and we want to know about any harms that were addressed. So that's now, we're hoping, pushing a little bit further to make that an actual meaningful process, not just putting names on papers, but making sure that the partnership was actually an equitable partnership. And then moving to reviewers, we also try and get reviewers from the regions of interest. So again, if you're, you need somebody on the ground who knows the context to be able to review a paper properly, in our opinion. So we will always get at least one individual on the review from the region that the work has been done in. We also aim to invite 50% female authors, reviewers. That can be quite tricky depending on the subject area, but it's something I think, especially as sort of full-time editors, we've got the luxury to actually make some real efforts with. And so I did do a little bit of a data crunching before I came, and this year we've been able to invite 49% male, 46% female, and 0.5% non-binary or gender diverse, and then 4% preferred not to disclose in terms of reviewers. So we're not doing too badly on that front, but we still need to keep an eye on it. 55% were from high-income countries, 43% were from low-middle-income countries, and there was no data for the remaining two. So that's reviews. We also I talked about it being an open access journal, so there's no barriers to reading in terms of money, so you don't have to pay to read whatever's in the journal. But we do recognise that that's not the only barrier to understanding the research we publish. There's also can be a language barrier because we only publish in English. So we've now also allowed authors to submit with their final paper a translated version of the abstract. So they can translate the abstract into whatever language they think is appropriate for the readership. So we'll then present that with the manuscript when it's published. And finally, we've just introduced geo-pricing. So again, there's no barriers to financial barrier to reading the journal, but we all know that with an open access journal, there is a barrier to publishing in it in terms of the money. So we've now set a tiered APC, article processing charge, which will come in from January next year. So depending on the GNI per capita of the country of the corresponding author, there will be a tiered price for the journal So those from the lowest income countries will have 0% of the APC, for example, and then it's sort of graded up. So yeah, that's me.
Thank you. Thank you. And because you're already touching upon the subject of open access, open data was one other one that we wanted to talk about. Xiao, do you want to share your thoughts about what your journal is doing with regards to open access? Is it a contributor to inequality? How can we solve that? Yeah, your thoughts, please.
Thanks for giving me the most difficult question to answer.
You're welcome.
I think the answer, the short answer is definitely yes. I mean, any costs for publication might make the system more inequitable. I don't have a solution. I don't think publishers have a solution. Ideally, in an ideal world, you would have a system that doesn't cost anything to publish and everything is open. But to do all the things that Marco described here and Zoe described, and having dedicated editors who will work with authors to improve the work, throughout the process, and engage peer reviewers. Peer review doesn't happen spontaneously, unfortunately. There have been many experiments, but if you don't have a good editor behind it, it will be an impediment to get papers published. And and development of policy. So all these things that we do have a cost, and actually the majority of the cost of publishing in journals like ours come from the people who are involved in the process of making these papers and the journal that comes out every week or every month. So yes, there isn't a perfect solution. I think Zoe already mentioned it, that many publishers are experimenting with tiered price. I think that's an option that could help to mollify the inequities that a full open access landscape creates. Our journals at the Nature Portfolio have approached it in a different way. We instituted what we call the Gold OA Fund, which is researchers that are based in low-income countries or lower middle-income countries can publish in any of our journals at no cost. It's in some ways, the researchers that can pay for the cost help to subsidize publication of researchers that are in places where resources are more limited. Also not a perfect solution. It's something that our publisher is doing. Many others want to take that approach. And I think what we will see is that the landscape will continue to evolve as more journals are, make the route towards become full open access. And then we have to develop new solutions. I think to your point of open science, everybody talks about open access, but open access is just one layer of open science. We spend a lot of time focusing on data sharing and how we can make the data behind the figures in our papers more available so that people can build upon results that were published and develop them further and find grounds for collaborations. This is also challenging. I think the communities that have for a long time established good practices of data sharing, like the genetics community, have developed their own repositories that are community recognized and have systems in place to allow data to be shared responsibly. But many other types of data, we still don't have a solution. I think many of you that work with human populations and individuals also have to deal with not a problem, but the reality that there are privacy concerns with data sharing that need to be taken into account. So I think what we will continue to try to do is to lower the bar so that people feel more confident and more comfortable with sharing data and creating more responsible ways to do that.
All right, thank you very much. So we'll hear from David. Now, from the show of hands that we saw in the beginning when Michelle asked the question, it appears that we've got a lot of experienced publishers here, authors here already publishing in high-impact journals. But I'm sure there are a few people, genoscientists, early career researchers from Africa who will gain a lot from especially somebody like David, who's been editor-in-chief for over 20 years. So what we'll ask David to talk about will be what his advice will be to early career researchers in Africa. Over to you, David.
David, you're on mute.
Yeah, sorry, I
Thank
just unmuted my. I think it is important for people who are starting a career in research and also in publication. Necessarily, the two go together. What I say is that one of the things that you always have to keep at the back of your mind when you want to publish is to make it to peer review. Because once the editors have looked at it and agreed that this is something worth looking at, it is only at that point that the manuscript gets pushed through the peer review process. Otherwise, it's rejected upfront. And for that reason, it is important that you consciously look for a journal whose scope fits the kind of research you're doing and the paper that you're writing. Because if your manuscript does not meet the scope, then it's not going anywhere. The other important thing to realize is that journals have audiences that they publish for. And so how you write a manuscript should also look at how best you can address the audience of the journal. In doing so, your first stop must be the instructions to authors that every journal publishes. And the journals also publish their policies regarding publication ethics, regarding plagiarism, regarding authorship, and there are international standards that most of these journals actually subscribe to. And you must be aware of these things before submitting a manuscript to a publisher or to a journal. Otherwise, your chances of having your manuscript, to start with, I think it is important for us to realize that you must get across the bar into the peer review arena in order to have a higher success of your manuscript being published. There are other issues about publication ethics that sometimes either we are not aware of or we close our eyes to hoping that the manuscript will sail through. But these may have consequences in future if your manuscript is subsequently identified as having ethical issues, not only with the research, but actually with how the paper is written. And one of the common areas where problems arise is in the area of authorship. During the COVID pandemic, at the Ghana Medical Journal, we suddenly realized an increase in the number of co-authors on manuscripts. Everybody wanted to publish something about COVID, and so a manuscript that under normal circumstances will have about 6 or so authors suddenly came up with 20 authors because everybody who smelt a bit of the case wanted to be an author. And being an author, it's not a very easy thing. You must realize that if there's a problem with a manuscript, it is not only the lead author who is affected, but everybody who is on your manuscript as an author is also affected. I think I'll stop here so that others can make inputs. Thank you.
Thank you so much.
Right. So before we open up for questions, so I just wanted to throw in a very important aspect of publishing that I've had some experience with recently, and this is how some people are probably using artificial intelligence. This is probably not common yet, but so I also have a role as associate editor for the International Journal of Infectious Diseases. And just last week, I was looking at a manuscript, impeccable English. So we have no problem like that in Zoe said. You can let the machine improve your English, so they can rephrase for you. There's no crime there. But what if you just get the machine to do that and then write your discussions, there could be a problem. So I was reading, this manuscript was about, thing to do in humans and in mosquitoes, but of course, the machine learning aspect, the machine has not learned a lot about mosquitoes, knew a lot about humans, and so all the introduction and the materials and methods and the results were pretty neat. But when it came to the discussions, there was not a single mention of a mosquito inside because the machine hasn't learned about that. So, I think in this aspect of that, I want to just throw that out to see what views will be. Over to you.
Over to me after that anecdote. I think we've heard now for a bit of time from our lovely panel of editors, but I'm sure you're here and you have some questions you want to ask. I also have some on a piece of paper, but it's much nicer to hear it from you directly. So if you have any questions, put your hand up. We have microphones. I think there's somebody in the back, I was hoping, yeah, with a microphone. So we will come to you.
Hello, good evening. I wanted to know how sometimes we submit to one Lancet and then we receive a response that, okay, we cannot publish in this one, but you can resubmit to another one. So how this discussion and how this, if the editors, they talk to each other and how is the process? Thank you.
Yes, that's a very good question. That's very common for us. We are a very permeable group of journals. So if we receive a paper and we don't think it is suitable for our journals, it is a judgment of the editor. We can show it to editors of other journals of the family. And that's done because, of course, if we receive a submission, it is our job also to offer, if possible, an alternative to the authors, and the alternative needs to be the best possible. So, I mean, probably each editor has its own preferences and its own hit parade of other journals. So it happens often that maybe a paper comes to the Lancet Infectious Diseases. We decide it's not for us for different reasons, and I can contact Zoe and let her know that we have this paper and she can assess the paper. And then only at that point, if the other editor has expressed an interest, we write to the authors and we communicate that we're not interested, and we give them the option. Of course, it's always the author's decision to transfer the paper to the other journals, and that's why we try at least to offer something to the authors if we are not interested, even because we have a very high rejection rate. So, I mean, it's rejection from one of our journals is pretty common, I have to say, unfortunately. So I think it's just fair that, we need to work with authors. We are not just the gatekeeper or the judges and just dismiss all their work, because if a paper is not suitable for our journals, it's still a good paper, it's still excellent research, it's still impactful research that can be published elsewhere, and then we should encourage and do our part in sort of helping authors to navigate the thousands of journals that exist and provide our suggestion, whatever weight the authors wants to give to that.
Okay. So hi, my name is Evezi from the Institute of Human Biology, Nigeria. So I've got two related questions, maybe not very sensible, but the first one is, from experience, what's the probability of an early career publishing in the Lancet, just to have some kind of context so that, one doesn't spend so much time targeting such journals. And that's one. And two, do you have a process in mind for manuscript writing workshops to guide young or early career researchers to fit into, the kind of context for publishing in the Lancet as a feedback or as a guidance to them, so that when they target those journals, they have some kind of what it takes to really publish in such journals. And maybe lastly, other than looking at, the science of what is being published, how much more of the writing style, how much does that impact on your rejection or acceptance of a publication?
Thanks for that. That's a really good question. So I think it very much depends on the project. So if you are an early career researcher and you happen to be working on a project that's a reasonably large scale or reasonably novel or has some good grant funding, so you've been able to do a sort of multi-country whatever, the chances are very good. We've definitely published. I don't know. I don't have the statistics to hand, but we've definitely published papers that have come out of people's PhDs. So it does happen. It just depends, the scale of the work that you're doing as an early career researcher. It's not that we sort of have some kind of assessment of your career stage when we're looking at the paper and see, whether that's going to make it or not. But we definitely do. I mean, if I ever go to a conference in a lower middle income country or anywhere actually, I will quite offer to run a workshop on writing. So that's something we definitely would like to try and help with. That we can't do that much sort of capacity building as editors really, because we're where we are. But that's one thing we can definitely help with. And so if anybody does want us to come to a meeting that they're organising or even do an online workshop at their institute, then please just ask one of us. I'm sure we'd be very happy to do that. In terms of the writing style, that would probably come out of a workshop like that. But my advice would be always to take the reader on a journey, write it like a story, so it has a beginning, a middle, and an end. That's really the only thing we're looking for. We want to know why you bothered to do the piece of research in the first place, how did you do it, and what did it add? I mean, essentially that's it in a nutshell. And if what you describe at the end of it is, we didn't really know what research was out there before, we just had a bit of a pop at doing something and we don't really know whether it added anything, there's probably more research needed or confirms what someone else has already done, then that's not something that's going to get into a high impact journal. So essentially that's kind of a very high level way of judging the writing style. It's not about the perfect grammar or wonderful technical language. It's more about the story, I would say.
Thank you, Zoe. And I just heard a little story here. Yeah.
So when you asked the question about early career researchers, I was wondering, when do you start? How early could that be until Zoe said thing about PhD? But I do remember that Professor Abdullah Dimji had a New England Journal of Medicine paper from his PhD, even before I think he was awarded the PhD. And so it can happen. And also he's from Mali, French speaking. So I think that it is possible it can happen, and most of us here can network.
Great, thank you. And I also heard
Michelle,
a very important advice.
Can I just add to Zoe here?
Where are we?
Here.
Oh, sorry. Yeah.
No, I just want to remind everybody, because we get this question quite a bit. I think in every panel that I have been, editorial panel, someone asks about early career researchers and whether that impacts our assessment of a paper. And I just want to remind everybody that very experienced researchers also get papers rejected, like every day, like many more. So sort of the rejection is an experience that everybody who does research at some level will go through. We at some point went through, because we come from a research background. So it's part of the process. And it's an opportunity to try to improve your work and find the right readership for it.
Yeah, good point. And I also wanted to ask the question by raising your hand, how many people have ever been rejected by a journal? And I'm sure that's many. So So don't think that just because you're in the early career, that's the reason you're rejected. We are all facing rejection a lot every day in all our careers. So there was another question here.
Thank you. My name is Gloria. Thanks to the panelists. So given the increase of having African researchers as co-authors on the different papers, are there policies in place to ensure that African researchers are not just being placed on those papers, but also being part of the study or being part of the write-out that is being published? Just concern. Thank you.
Who wants to tackle that?
I think, Zoe already started answering this question when she was talking about equity and, having reflexivity statements in our papers. We are doing the same, which is essentially asking the authors to really explain, what each person that's listed as an author did for the study. And, I think that piece of information is particularly important for us editors because it may affect our take on the paper if you feel that the distribution of responsibilities and that paper is not really a partnership between the researchers in high and low middle income countries. Maybe we won't want to publish it, so it sort of becomes a very central element of our assessment. And I think generally authorship will come with several responsibilities, as has been raised here, and we take that very seriously. We expect that whoever is listed as an author in our papers really has contributed significantly for the research.
Thank you. And I see David on our screen, and I was wondering, David, before we go to the next question, do you want to add anything to this discussion? And you're muted again.
I think that in addition, my approach towards the authorship problem is that when you're doing collaborative research, it is important to determine what manuscripts can come out of the research potentially, and also discuss who is going to write and who is going to do what, so that everybody knows their place and nobody complains after the manuscript is submitted to a journal. I think it's very important that you get into that habit if you are doing collaborative research. There was also an earlier comment about building capacity of young research in manuscript writing. And the Ghana group of young researchers to participate in a workshop. And in fact, our first workshop, which was done over 10 years ago, was actually moderated by editors from the Lancet. And so we have kept part of that tradition. We recently had another one for editors that was said by editors from the Lancet, because the Ghana Medical Journal has a relationship with the Lancet in a partnership arrangement that is called the Africa Journals Partnership Program. And so it gives us access to the Northern journals, as I will put it, like the Journal of the American Medical Association, the British Medical Journal, the Lancet, and we are able then to tap into the expertise available and use that to guide our young scientists on how to do things. And I think the arrangement is very good. But certainly authorship is a big thing. And I think authors, especially young scientists, should understand this. There is the tendency to put your head of department on the list of authors when he doesn't know anything about the work that has been done. And that is not helpful at all when matters go south. Thank you very much.
Thank you. Where do we start? Okay, the microphone is there first.
Thank you so much. I am Kuba Antoine from the Democratic Republic of the Congo. So my concern is about the reason of rejecting the papers. So I'm going to give my own experience with one of the journal representing by one of you there. So
Not to be named.
the reason was that the names, the number of the authors was unbalanced between my country and the overseas authors. So actually, it was not right because the authors from DRC were more representative in the paper than those from other countries. So in this case, is it possible to resend the message to the editor, giving some response, to reply to the editor to say that the reason was not right? Is it possible? Thank you.
I think that was my journal. I think I can guess which journal it was. And just to say, I've never been on a panel where someone hasn't taken glee in saying I rejected one of their papers. So, you know. So I think what you will have received was a generic rejection letter which listed a number of reasons. So we might list things like novelty, you know, the suitability of the methods. And then we also, because we want to send this message that we're not accepting papers that don't have any representation on the authorship from the region. So we also include in the generic rejection letter, it may also have been the case that your paper was rejected if there are no authors from the region. That doesn't mean that it was the case in your case, and of course it sounds like it wasn't at all. So it's very likely that that wasn't the reason why the paper was rejected. But whenever a paper is rejected, everybody is always at liberty to appeal the decision. If you think an editor has made a mistake, and we do make mistakes, or the peer reviewers have made mistakes, if it's gone to peer review and been rejected, then there's always recourse to appeal. So you should always, if you believe it's been a mistaken decision, write back to the editor and set out your reasons. You know, don't just say you should have published it. You know, you need to explain why. And there's a formal in-house process then for assessing the appeal. So we'll go, not just the handling editor, but the rest of the team will also get together and discuss whether or not we should reconsider the decision. So that is definitely always an option open.
May I just add one personal anecdote? Before COVID-19, the most cited paper in the Lancet Infectious Diseases was an article that we had rejected twice. So, and the authors appealed twice, and then we published it, and it was the most successful paper. So, if you feel that you have ground for appealing, do it, because I mean, it's constructive, and I mean, we are not afraid to say, well, we were wrong if you explain and you demonstrate that you're right. So, I mean, it can happen.
Hello. This is Shubhra Chakraborty from here, Johns Hopkins University, USA. Want to know how you choose the Lancet series topics. Is it from the editorial board or editor, or an author can suggest a topic and send you a proposal?
Well, basically, all the answers are legitimate. I mean, there are some series that start from ideas that we have that we think might be interesting for our readers. There might be series that were born by suggestion from the editorial board, but absolutely, in my experience, in most cases, the idea came from authors who propose a series, and as a sort of pre-submission query, maybe, asking, we have this idea, would you think it is interesting? And so all options are possible, absolutely. I mean, proposals are welcome.
Thanks. Emma Ross from Chatham House. I just want to pick up on something Joao mentioned about open science and data sharing. Appreciate it's difficult with the data quality or the platforms for storing it, but do the journals see any role for themselves in taking a stronger position on, you said you hope they feel more comfortable sharing data, but in requiring, if you want to publish in our journal, especially if your research was done with public money, I know funders have a role also in requiring this, but is there any discussion of journals taking a stronger position to require it? And if so, is that journal by journal, or is the journals getting together in solidarity? Because obviously if one journal makes that a requirement, there'll be journal shopping where it's easier.
Yeah, thanks for this question. Maybe I can start by telling you where we are right now, and I think that's a common approach for the journals represented here. We do not require the data to be shared, the source data to be shared, but we require you to provide a data sharing plan or a data sharing statement in which you have to lay out what is the data that underlies your study, whether that will be made available to whom, when, and if there are any conditions for data access, that all of that should be very explicit in the data sharing statement. Sometimes that will also color our decision of publishing a paper or not, because if the value of the paper lies on the source data, then if you're not going to share the data, maybe we don't want to publish the paper because other people won't have access to it. So what is the point for us to publish? So I think that's where we are now. Where we are going, yes, ideally, I think we want to get a point where most types of data are shared widely. I don't think the medical journals, I'm part of the ICMG, the International Committee of Medical Editor Journals. So, from my understanding, and that in that committee, the majority, I would say the big medical journals are represented, and also region-specific journals are also part of the committee. And I don't think at this stage there is a clear, I wouldn't say a commitment, but there isn't really a clear timeline to achieve that. I think we're taking incremental steps towards making data more available as default. But I think this will be a process and it will take some time to get there.
Yeah, if I could just quickly add, I think, so what our journals are coming from the recommendation of the ICMJE, the International Committee of Medical Journal Editors. So that's specifically for medical journals that are, publishing research about real human beings. And I think that there was a reasonable consultation process that was gone through before that statement by the ICMG was adopted by most of the medical journals. And there are, I think the principle was that we were going to go ahead and demand it, but actually there was pushback from the community mostly. Data handling is not cost neutral as well. So equally from an equity perspective, if you're in a low or middle income country and you're being expected to create some kind of data repository that has a secure environment, you've got data managers to process the applications, to access the data, that's actually a consideration as well. So there's still a lot to work out, I think, before we can move towards that, although I think it's important that we do sort of have that ultimate goal in the end.
Yeah, maybe can I just share a story because it's very recent. Maybe a month ago, Nature, our flagship journal, published a genomics study with genomic sequences, DNA sequences from people from Latin America, from a specific country. And we were, I think, for the first time, directly asked to waive the requirement to share DNA sequencing data, which is a requirement in the Nature journals because there are, access control repositories that are very well established. So there is a way to share data in a way that's responsible. But we were asked to waive that requirement for 2 years so that the local researchers who had invested a huge amount of national resources and had done the entire work could mine the data for some time before the data was made available to the entire community. As I said, that's the first time we were asked to do that, and we didn't have an answer. I think in the end of the day, we considered the pros and cons, and we came out on the side of making this allowance. But this is the kind of questions that will be faced as we move towards more data access. If you're doing your research in a resource-limited setting, and the data you've generated is really precious, and it's what's going to drive your success, the success of your career and development of your laboratory and your institution and your ability to get grants, is it okay that someone in a higher income country with a lot more resources and the capability of doing research at a much faster pace to come and use the data, for whatever purposes that they want to do? So, as I said, I don't have an answer, but I think these are the types of questions that we'll be facing moving forward.
Yeah. Thank you.
Anna Happel from the...
That's not me. I'm John Japon from Ghana. And my question is directed specifically to David. Why would anybody from my institution or your former institution do some very novel work, new vaccine showing tremendous efficacy and all that, want to publish in the Lancet instead of the Ghana Medical Journal? And I basically talking about journals within sub-Saharan Africa.
I think that part of the answer to your question is the reputation of the journal, which is built on a lot of factors that I'm quite sure most people have. It gives you visibility, it gives your paper visibility if it gets published in a particular journal that is well known. The difficulty of most African journals, or most journals based in Africa, is the problem of global visibility. And you achieve your global visibility partly through your presence on well-established, what do you call them? Like Scopus, like National Library of Medicine, PubMed Central, Scopus. If you appear in those journals, the chances are that you will be easily picked up because most authors looking for published articles to look at will go to those spaces. And so that is part of the problem, the quality of the journal and also its global visibility. This organization that I referred to earlier that encourages, is trying to encourage African scientists to publish their works in African journals, actually has one of its objectives to set up to help the African journals position themselves to appear in all these major index systems like PubMed, like Scopus. And so we have managed in the course of time to get some of these journals actually to be listed in these indexes. And it is only when we have achieved that visibility that other countries or other scientists will try to publish in your journal. Otherwise, their first choice is going to be in a journal that is widely visible, and they would want to then have their work published there. I think the interesting thing is that Lancet continues to receive many, many manuscripts for consideration, even though they have a very high rejection rate. The tendency is for you to go there first and see whether your manuscript will get to peer review or not. I think the onus lies on scientists in Africa to support their local journals and also to encourage the local journals themselves. When you are visible, that you start getting noticed. For example, again, many academic institutions now looking for scientist publications for promotion. For example, will look at whether that article was published or is indexed in Scopus or is indexed in PubMed because of the reputation of the system of selecting manuscripts.
Thank you, David. Thank you for that answer. I have many hands here, and we have about 5 minutes left, people. And we must end the session on time. But these editors are going to be here for how many days more? Two? 1, 2, maybe? Zero. So you can always grab them in coffee breaks, lunch breaks. I see somebody there in the back. Quick question, please.
Sure. Anna Happel from the University of Cape Town. As an early career researcher, I was wondering whether you could briefly comment on your career paths. What's your background? How did you end up in your current position?
Ooh. Can we ask one person?
I can start. So I'm from Brazil originally. I did my education there for the most part. I'm a physician by training. I trained as a psychiatrist, and at some point got involved with research in a completely different area, immunology. Did a PhD in immunology and went to the United States for a postdoc that was supposed to last 2 years, but 2 become 3 and 3 become 4. And towards the end, I had just published a paper, and I met the editor who had handled my paper, and we had a very nice conversation, and I learned more about what being an editor would entail, and it seemed to me a very interesting opportunity to participate of the scientific enterprise from a very different perspective. And then I took my first editorial job.
Thank you. I'm not going to go down the whole path because I think I want to give room for maybe 1 or 2 more questions, quick questions, and then we have to wrap it up.
Thank you. Andrew Weeks in Liverpool. Can I ask you about the thorny issue of fraud in publication? And I don't ask you about your own journals, because I think your own journals are probably very good. You've got the resources to ask for the original data, etc. But what do you think that the publishing community should do when it's reported that maybe 5 to even 20% of papers are either erroneous or come out with the wrong conclusions or are downright fraudulent? Because I work with both Cochrane and writing guidelines, and it's an impossible job because actually this poison seems to spread through a lot of them, and maybe even our guidelines are all. But you're at the front line of trying to protect us as guideline writers. How can you reassure us that journals as a whole are going to be healthy and a good place to get good data in the future?
I think it's very difficult because there are lots and lots of new journals, and not all journals are accountable for the output that they produce. So I think we talked a little bit about choosing journals and how you choose journals. I think the most important thing when you choose a journal, it's a service provider. It's providing you a service. So it needs to be able to bring your research to the audience you want to reach. It needs to be reputable. It needs to be a clear path for communication with the editorial team, and there needs to be accountability post-publication, because our job doesn't end when the paper gets published. If there is anything that's raised about any aspect of a paper that was published in one of our journals, we are responsible for looking into it, sometimes investigating it, and taking appropriate action. So I think, ideally you would want to have all journals working at that level, but the reality is a little bit different.
Okay, so my name is Joe Bonney from Ghana. I'm the journal. So David is my editor-in-chief. So my question is, in order to promote the local or lower journals or journals in low and middle income countries, is there a possibility that the more visible journals can look at options of co-publishing in at least options that are available, an article to be published in Lancet and say co-published in the Ghana Medical Journal, and how are we trying to promote this in sectors? Thank you.
Who wants to take that?
I can go. I think that's a really interesting one, actually. I think, the logistics of it, I think, would take some working out. So, which journal would be the sort of primary source, and so who would have done the peer review, whose bar were you reaching? I think for example, I mean, we do have occasions where our research is republished. They tend to be it's not research. It tends to be more the commentary type pieces. So if we've published something in the Lancet Global Health, because it's published under a Creative Commons license, the authors hold the copyright, and so they are actually entitled to republish it wherever they want, actually. So we have done that. I know some of the commentary type stuff that we've published has ended up in a different outlet that might have a different audience, or maybe it's been translated into a different language. So that can work. I think doing a full research paper would be more tricky, but I quite like the idea. So let's chat.
Well, I think that's a very good note to end on. Apologies, but we have to end on the hour. We agreed that there are some other people, as you know, working that have got to go on time. So thank you very much to everybody. We want to thank our panelists. And to you for all the wonderful questions. And I hope you sort of enjoyed and also learned a lot from the responses. Thanks again, and have a good night.
You're very welcome.
They have many more questions. I think you would hide in the coffee breaks. You're leaving tonight?
I'm leaving, unfortunately, because I actually have another panel that I had already agreed to do tomorrow.
It's a shame.